So I'd like to go over what we're looking at when I tell a patient they have hip dysplasia and what these angles mean. And so this is an actual patient from intraoperative surgery with hip dysplasia. And hip dysplasia is defined as if you draw a center dot in the center of mass, and we have computer software that does this so it's accurate, and draw a line straight up from this and an angle to the edge of this bone, is what is that angle? And to me, it's not just about what that number is, but in this patient, it's 20. It's when they walk, if you can see on this diagram, the line of weight bearing exit is right here. So this patient's hip socket, which is right here, all of their weight when they walk is only going through this one spot. And what I tell patients is this is very similar if you wear a shoe out on one spot because it's balanced weird, or if you have to get a new tire on a brand new car, the forces aren't distributed equally across the 4 tires. So you have all the weight across one of them and it wears out quicker, which is why teenagers upwards of 30, 40-year-olds have hip pain, and it's not arthritis yet, and it's because you're wearing out the one location prematurely and the rest of the hip is very healthy. And that's where we do a PAO, because ideally this socket should be all the way over here so that when you bear weight, the forces are through the whole hip. So this is after we're finished with this patient that started with a socket when the weight-bearing line was right through here, now is equally bisected. And if you can go back and look at the other x-ray, the socket's now coming out to the edge of the head-neck junction, and this is a much more contained hip, and the degree of this angle from here to here now measures 35, which is structurally perfect. And the screws are there, and patients and families like to focus on these screws. They're holding the correction in place while the body heals this, and you'll go over on a model where all these cuts are. But now this is a well-functioning hip that should last her 20, 30 years before she acts up with her hip again. And so this would be a successful hip preservation surgery. And if you have any other questions about your x-rays, please let me know.